2nd, 2026. Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. Our patient is having laser spine surgery done on her back. She travels here from Hawaii. She came to Deuk Spine Institute because we offer the most advanced state-of-the-art treatments for back pain in the world. We have patented procedures that are only done here at Deuk Spine Institute. These treatments are permanent pain relief for back pain and neck pain. She did not want invasive surgery on her back, so here we are performing Deuk laser disc repair for 2 very painful discs. Now, not all back pain comes from disc herniations or disc injuries. Some of the back pain actually comes from other sources, like the sacroiliac joint, the piriformis muscle, the facet joints. In her case, it's coming from 2 discs, L4-5, L5-S1, which are herniated more off to the left side. She has back pain from the disc called discogenic back pain. Anthony, let's show the audience the 30 different causes of chronic debilitating back pain, please. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You can see from the video that there are 30 very specific causes of back pain. We discovered those 30 causes here at Deuk Spine Institute, and we are now actively treating each of the 30 causes with patients. We're able to cure pain from those 30 causes. We don't treat tumors. We don't treat infections mostly. Sometimes we'll do a disc infection if somebody has an infection in their disc called discitis. But for the most part, we treat the degenerative conditions, the chronic pain conditions not related to tumors, not related to fractures. But 99% of chronic back pain comes from discs, disc injuries, from facet joint injuries, from piriformis muscle injuries, and sacroiliac joint injuries. Are you awake?
Are you awake?
Our patient has had back pain for 3 years, debilitating, along with left leg numbness, weakness, and tingling. Are you having any pain?
Are you having any pain right now?
When I did her interview on Zoom, she's from Hawaii. We're in Florida. She had back pain in this area. I looked at her MRI. I saw 2 discs that correlated anatomically with abnormalities that could be causing back pain. And we ended up diagnosing her with discogenic back pain. Are you comfortable?
Yes.
You having any pain? Don't move. All right. How bad is that on a scale of 1 to 10? 10 being the highest pain.
Give us a number, 1 to 10.
What's the highest?
9.
Is that where you get your back pain?
Yes.
All right, we call that concordant. She had 9 out of 10 pain. Is it better now? That was L4-5, 9 out of 10, concordant. The procedure we're doing, folks, is called a discogram. It tests to see if the discs are indeed causing the patient's pain. In her case, L4-5 is definitely causing her typical back pain she gets every day. She's had for 3 years. That's debilitating. Jordan, show us on the x-ray. Anthony, go to the x-ray view, the lateral view. Show us the tear in the back of the disc. You see that white arrow, Anthony?
Yes, we do.
Are you on the x-ray, Anthony?
Yes, I am.
All right, that tear right where Jordan is circling with his arrow, that is where all the back pain comes from. That small area about the size of a small grape. Okay? So that was L4-5. Are you better? Yes. All right, we're going to put you to sleep soon. How bad is that on a scale of 1 to 10?
Give us a number.
What's the highest? How high does it go? What's the highest? All right. Is that where you get your back pain?
Yes.
All right. You get to go to sleep. I want you to count from 1 to 100 out loud. Folks, we just confirmed she traveled from Hawaii to Florida to have 2 discs repaired at Deuk Spine Institute, the only place in the world you can get Deuk laser disc repair, the laser spine surgery that provides a cure to back pain that comes from disc injuries. She traveled thousands of miles for this procedure. We just confirmed that the procedure is going to work, which we already knew it was going to work to begin with. Now, one thing about this surgery is that it's outpatient. Patients are going to go home an hour after surgery. And this is how much blood loss we get. It's a nosebleed. That's it. okay? As long as our anesthesiologist does his job with the blood pressure. So this patient, we're going to keep her blood pressure around 110 or lower, and that will keep her from having any bleeding. You basically don't lose blood during the surgery. There's just a tiny bit. Yeah. No, I know. The discogram raised her blood pressure. Why? Because it hurts. So pain always increases blood pressure. Right, Dr. Berndes? So you basically did not believe that the discs were painful. Just kidding. Any questions from our audience?
Yes. We have a question from Dom on YouTube.
Dawn?
Dom, D-O-M.
Dom on YouTube, welcome to our live stream. Yes, I'll take Dom's. Thank you, Jordan. Dom's question.
How many nerves are in the SI joint, and does a Deuk plasmarotomy permanently disconnect those joints?
There are 5 nerves in the SI joint shot, and the Deuk plasma rhizotomy does permanently treat those 5 nerves. Yes, it basically rhizotomizes or destroys the 5 pain nerves to the SI joint. Each SI joint has 5 nerves. Wait, let's see. Thanks. That's perfect. You can see from the x-ray, take one more shot, perfect. Jordan, show the audience what's happening here. Just so you can all see on the x-ray, we have placed a tubular retractor at L5-S1. Remember, she had herniated disc on the left side, which is the side we're on. She has radiculopathy, which is basically nerve dysfunction from the nerve roots being compressed. And we are right there in the foramen. We're going to decompress the nerve root, and we're going to treat the tear in the back of her disc at L5-S1 that's causing all of her back pain. Now, her back pain comes from 2 discs that are damaged, L4-5, L5-S1. If you have questions, feel free to ask. In the meantime, please show the audience how a disc injury, like an annular tear, herniation, causes back pain through the process called inflammation. And while Anthony shows you that, first of all, look there at 11 o'clock on your screen. You guys see that pink material around 11 o'clock in that annular tear? That's inflammatory tissue. That's why she has so much back pain. It's inflammation happening here. And that was discovered here at Deuk Spine Institute by me. I'm the one who discovered and first published the fact that annular tear inflammation is the cause of 85% of chronic debilitating back pain and neck pain. All right, let's show the audience how a disc injury, like an annular tear with herniation or disc bulge, disc protrusion, disc rupture, will cause so much pain. How does that process occur?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that people who have trauma to their lower back, whether they fall off a bicycle, skateboard, motor vehicle accident, sports injury like football tackle, soccer tackle, whatever. There's about 100,000 ways you can injure your disc in your lower back. 100,000 ways. Okay? Gymnastics, very common cause of disc injuries. But once you injure the disc, your body has to make a choice. We're going to create inflammation in that injured disc or we're not. And in some people, they have disc injuries but no inflammation. If you have a disc injury, like a herniated disc on your MRI, but you have no inflammation, you're not going to have any back pain. So it's not everybody that has everybody with a herniated disc or degenerated disc doesn't have back pain. Okay? Only a small number, about 10% of our world's population that has a herniated disc in their back will have back pain. Only 10%, 1 out of 10. That's an estimate. But when you do have that inflammation, at least now you know there's a cure. And that cure is the surgery you're watching right now. I know we have questions. I'm going to answer them in a moment. But before I do, I want Anthony to show you a video on how Deuk Spine Institute has pioneered the first definitive treatment to cure back pain that comes from disc injuries, okay? Which is exactly what this patient is having done.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-692.
Back. If you're looking here at the endoscopic view, you can see the laser fiber, which has a blue plastic coating, and it has a glass fiber which transmits laser energy from a machine that produces that energy. That machine is plugged into the wall. It is 220 volts machine, so it takes a lot of energy, a lot of electrical energy to produce the laser beam. Now this laser machine is manufactured by Luminous out of Israel. Now Luminous just sold about a year or two ago their company to Boston Scientific, which is a medical device company, and now Boston Scientific owns the manufacturer of these lasers. But these are all FDA approved. Everything we use at Deuk Spine Institute is FDA approved. We don't use anything that is not FDA approved. So if people are wondering, is this FDA approved procedure? Yes, 100% Deuk laser disc repair is an FDA approved procedure. As a matter of fact, I think it's against the law to use things that are not FDA approved. So we make sure everything we do is FDA approved. The endoscope you're seeing is a Wolf endoscope from Germany. It is the best endoscope in the business, in my opinion. And there are other manufacturers of endoscopes, but I believe this is the best for our purpose. And this endoscope is FDA approved. Everything we use is FDA approved. So, any questions?
Yes, we have a question from Suman on YouTube.
Hi, Susan on YouTube. Welcome to our stream.
Can disc injury, like a bulge or extrusion, heal itself?
That's a great question. I get that question a lot. Can a disc injury, like a herniation or a bulge, heal itself? The answer is no. They never ever heal themselves, and they're always going to be there. But I know the internet is full of people saying they heal themselves, but it's not true. The people that say they heal themselves are chiropractors and physical therapists. What they're trying to do is get your business, but they're not telling you the truth. They basically want you to do 8 weeks of physical therapy or chiropractor with them, where they put you on a machine that pulls you apart called a VAX-D machine. That VAX-D, V-A-X-D machine basically does nothing. So what they're really doing, just so you understand, is this disc injury will not heal itself ever. You will always have a bulging disc, herniated disc, degenerated disc. But the inflammation you have around the disc injury will go away over time. So that inflammation goes away, but the herniation never goes away. The annular tear never goes away. The only way to get rid of a herniation is what you're watching right now. Endoscopic laser surgery. The other option is to do a microdiscectomy, but that doesn't get rid of back pain because they're only getting the pressure off the nerve root. And it's not the pressure on the nerve root that causes back pain. Microdiscectomy only gets the pressure off a nerve root. It does not actually repair the annular tear like we're doing right now with the laser. The only surgery in the world targeted to get rid of back pain and leg symptoms is the surgery you're watching right now. Deuk laser disc repair, only available here at Deuk Spine Institute in Florida. Got to travel, folks. This patient traveled all the way from Hawaii to come to us. And she's having her back fixed today. We're going to be fixing her neck later in the week. Any more questions?
Yes, we have a question from Lanu on YouTube.
Hi, Lanu. Welcome to our stream.
Do you repair carpal tunnel?
Do I do carpal tunnel surgery? Yes, I do. I'm a neurosurgeon. I've been trained to do carpal tunnel. I actually have a few videos for carpal tunnel on our website. If you go look, you can find on our YouTube channel. You can find a carpal tunnel release. All right, just about done with this L5-S1. And then we're going to move on to L4-5.
Too long, please. Thank you.
Any more questions?
Yes, we have a question from Dom again on YouTube.
Sure.
Can a fusion spinal segment in the lumbar spine have facet joint pain?
It's a little too low volume. Can you come closer?
Okay. Can a fused
Watch it.
spinal segment in the lumbar spine still have facet joint pain?
That's a great question. Can a fused segment in the lumbar spine still have facet joint pain? The answer is no. If the segment is fused, that means the facet joints are not moving, therefore they cannot cause pain. It's impossible. So, fused segments of the spine never cause pain. Okay? They never cause pain. The only way you get pain is from movement of a painful joint. Those joints are the disc, the facets, the SI joint, or a piriformis muscle tear, which is not a joint, it's a muscle. Those are 99% of chronic back pain comes from the disc moving, a painful disc moving, a painful facet joint moving, a painful SI joint moving, or a painful piriformis muscle. That's it. There's no other causes of significant causes of back pain. Yeah. Okay, that's it. Now there is 1% that we're missing that we're not talking about. That is tumors, fractures, infections. Okay, that's very rare, 1% of chronic back pain. Tumors, fractures, infections. And we do treat infected discs here. We've actually had patients come, they get surgery somewhere else. The surgery resulted in an infection in their spine. It's very hard to treat a disc infection. It's called discitis. So they find us and they come here, and I can do endoscopic surgery. I can clean out the infection out of the disc, and I can put antibiotics in there. And the antibiotics will directly treat the infection in the disc. It's pretty amazing. And it's the best way to treat a disc infection. But we don't advertise disc infection treatments because we don't want people coming here with infections they get somewhere else. Okay? We've never had an infection in our patients, not once. And we like to keep it that way, but we will treat other surgeons' infected patients. Did I answer the question?
Yes, you did. We have one more question from
Sure.
Ivan on YouTube.
Hi there.
How does the dye remain only in the inflamed tissue?
I just can't hear you. You're not speaking loud enough.
Hello, can you hear me now?
All right, go ahead and turn the volume up in the room.
Can you hear me now?
Yeah, you just have to enunciate a little clearer. 5
Oh.
minutes, Berndes, 5 minutes.
Why does the dye remain only in the inflamed tissue that needs to be removed? How do you determine which tissue should be preserved and not removed during the surgery?
Yeah, so the question is, Dr. Deuk, you're inside this disc, and how do you figure out what needs to be treated? I call it experience. It comes from many years of doing these procedures. How many of these laser procedures have we done to date, Anthony? You've been keeping track.
We've done 2,765.
2,765. Thank you, Anthony.
Yes.
So we've done 2,765 laser surgeries with an average of 2.4 discs per surgery. So that's a lot of discs that we've repaired over the years. That's been 20 years. So we're averaging about 140 cases a year. Okay? I got to say though, the last few years we've really picked up the pace on these surgeries. So with almost 3,000 surgeries and about, 8,000 disc repairs, that's a lot of experience that I have as a neurosurgeon repairing these discs. So I use my experience of treating thousands of patients successfully to help me determine the limits of my surgery, like when to stop, what exactly needs to be removed. Okay? But this is called a debridement. And again, it's an annular debridement, and I'm the one who pioneered this technique. I'm the founder of Deuk Spine, and I'm the pioneer of this surgery. We had it published first time 14 years ago, actually 15 years ago, was our first publication in the scientific literature. This has been peer-reviewed and published over 11 times, this procedure. It's FDA approved, and how to do the procedure, I make it look easy on YouTube for you guys to watch, but obviously there's a lot of skill required to do this procedure. So much skill that other surgeons cannot do it because they lack the training and skill to do this procedure. Any other questions?
No questions at this moment.
Thank you, Anthony. Let's go ahead and show the audience then why this surgery is better than other types of spine treatments that other doctors are offering out there, like the mild procedure or disc seal or laminectomy, fusion, steroids, spinal cord stimulator, artificial disc replacement. All of those procedures are far worse for patients when it comes to outcomes. They don't have the same good results this procedure does when it comes to eliminating back pain. We have a 99.6% curing discogenic back pain rate with this surgery. That means this patient that has discogenic back pain, we just confirmed it on her discogram. That pain she has from these two discs, 99.6% of it will be gone on average. That's our average. Now, we do have a 1% reherniation rate. That means out of every 100 patients we treat, 1 in 100 will come back re-rupturing their disc. they did something they shouldn't have done. Bend over, pick up something heavy in the first year. What I tell everybody is take it easy for 1 year. Let the annular tear heal properly. It doesn't matter that you're feeling great, you have no more back pain. What matters is this area of the disc does not have much blood supply. It's poorly vascularized. So because it has very little blood supply, 2 minutes, it doesn't heal quickly. So you got to give it time to heal. Give it time to heal. Just take it easy for a year. You can go to the gym. You can work out with weights. Just keep the weights under 40 pounds the first year. I don't want you bending over the first 6 weeks. Okay? We don't need to bend over. You just keep your back straight. You can sit on a chair. You can go sit on the toilet. You can take a shower. You can do a lot of things you normally can do. You can drive a car, but you cannot lift anything heavy the first year. All right, any other questions from our audience?
No questions.
Then let's show that video on why the Deuk laser disc repair is better than the other treatments that doctors offer. Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you